So there's 3 levels in autism. Autism is a lifelong developmental disability, and there are around 700,000 autistic adults and children in the UK. Most cases are diagnosed when children are under 12, but sometimes it's diagnosed later in childhood and adulthood. What we tend to find is that level 3 need quite significant support. Brain development has been impacted in some way according to scientific research. Executive function is often referred to as the management system of the brain, and it helps us to get things done, start things, set goals, plan, organise and manage daily life. And this has absolutely exploded in the last 2 years. In addition to this, researchers identified that between 30 and 80% of autistic people also have. Okay, so there's lots of overlap between autism and ADHD, and this has absolutely exploded in the last two years. And I'm just going to talk through some of the similarities and differences. So autism is a lifelong developmental disability which impacts how a person communicates and interacts with the world. More than 1 in 100 people are on the autistic spectrum or are autistic, and there are around 700,000 autistic adults and children in the UK. Autistic people can have challenges interpreting non-verbal communication and interacting with others. Autistic people can look like everybody else, but also they have their own differences. Each autistic person has a set of distinct strengths and challenges navigating through the world. Some autistic people have acquired verbal ability, so can speak, while others are non-verbal or have minimal verbal expression and communication in other ways. Some autistic people require significant support in their daily lives, while others need lesser support. In some cases, live entirely independently for a majority of their lives. But that doesn't mean to say that they don't have challenges. I've got to make that clear. There's different levels in the DSM-5, which is the Diagnostic Statistical Manual. So there's 3 levels in autism. So we've got level 1, 2 and 3. And what we tend to find is that level 3 need quite significant support, whereas level 1 would need requiring support. There's different models and approaches to autism. We have the medical model. So that views disability within the person and something that can be fixed and cured. We've got the social model, which views disability as interaction between people with social and communication barriers. And the neuroaffirmative approach focuses on autistic presentations as differences and not disorders. And Steve Silberman talks about this in his Neurotribes book, if you've had the opportunity to read it. If not, I'd highly recommend if you can purchase this book. When we're thinking about ADHD, ADHD stands for Attention Deficit Hyperactivity Disorder and is a condition that affects people's behaviour. ADHD people can seem restless, may have trouble concentrating and may act on impulse. Symptoms of ADHD tend to be noticed at an early age and may become more noticeable when a child's circumstances change, such as when they start school, and can impact their academic learning as well as their social relationships. Most cases are diagnosed when children are under 12, but sometimes it's diagnosed later in childhood and adulthood. Sometimes ADHD is not recognised in childhood, and these are the cases that I tend to see. And actually they're diagnosed later in adulthood. And this is often because lots of structures have been put into place for them in childhood, or they have an incredible inattentive presentation that wasn't as overt. The symptoms of ADHD may improve with age, but many adults who were diagnosed with the condition at a young age tend to continue to experience difficulties. People with ADHD may also have additional problems such as sleep and anxiety disorders, as well as depression. So that's not uncommon. ADHD and autism frequently co-occur. Many people with one or the 2 diagnoses show elevated traits of both ADHD and autism. Common experiences for ADHD and autism include sensory differences, intense focus on specific interests, rejection sensitivity, executive dysfunction, sleep issues, and emotional regulation. Someone with ADHD is more likely to seek out the novelty and make more impulsive decisions, whereas an autistic person is more likely to crave routine and structure and order. If someone is autistic and has ADHD, they're known as all ADHDer. They may experience an internal struggle and tension between their competing autistic and ADHD traits and a heightened experience of shared traits. This is not uncommon. For example, the executive function challenges, they overlap in those with ADHD and autism. Executive function is often referred to as the management system of the brain, and it helps us to get things done, start things, set goals, plan, organise and manage daily life. And they tend to include inhibition, self-monitoring, mental flexibility, emotional control, initiation of tasks, working memory, planning and organising, task monitoring and task completing. So there's quite a lot of stuff going on there in the system. And those with ADHD and who are autistic can have significant challenges in this area. Research has shown that autistic people have differences in the way their executive function system works. This commonly includes preferring consistency, finding it harder to shift between one task to another or inactivities, experiencing greater range and intensity of emotional responses, finding it difficult to initiate, particularly when faced with unknowns or multiple options, needing more time to process information, may not be able to hold down lots of different information in mind. So there can be challenges with the working memory when trying to consider all these options at once.
Harley Therapy, the UK's leading experts in therapy and mental health care, right here in London or online.
Common experiences for ADHD and autistic people include sensory differences, and I've touched on this before, a focus on special interests, the rejection sensitivity, and sleep and emotional regulation issues. In addition to this, researchers identified that between 30 and 80% of autistic people also have ADHD. So when you're going for that assessment, it's definitely important that you're screened for ADHD. Keep that in mind. Increased stress often leads to greater executive function and attentional difficulties. So that management part of the brain finds it a lot more difficult to manage when stress increases. Research indicates adults who are autistic and have ADHD face greater functional challenges day to day compared to those that tend to have one or other diagnosis alone. The presentation for an autistic person can involve not understanding verbal and non-verbal communication, having speech and language delays, difficulties developing and maintaining and understanding relationships with other people, as well as maintaining them. Someone who has ADHD may display common traits such as being easily distracted and unable to concentrate on a task. They may also be impulsive, and this may include interrupting conversations or have a little or no sense of danger. They may also show signs of hyperactivity, which includes not being able to sit still on a chair or intrude on other people's conversations and activities, even if they've noticed that that person's busy. Why is it common for individuals to receive both an autistic and ADHD diagnosis? Well, according to scientific literature, 50 to 70% of individuals who are autistic also present with ADHD. Both ADHD and autism are known as neurodevelopmental disorders. So what they're referring to there is the brain development has been affected in some way. That means that both disorders affect the central nervous system, which is responsible for, let's say, movement, memory, language, social and focusing skills. A number of scientific studies have also shown that the two conditions often coexist, but researchers have not quite figured out why they do. With ADHD and/or autism, brain development has been impacted in some way according to scientific research. How can the social and communication differences in autistic people be distinguished from attention-related challenges in ADHD? Well, one thing to think about is that those with just purely ADHD can read non-verbal cues of others. Their social interaction with others, they will approach others, and often you'll see this in childhood. They will maintain conversations. And the repetitive and restrictive behaviour and interest is different to those presented in those who are autistic. So what are the impacts of the overlap in an autistic and ADHD person's everyday functioning? Well, number one, they're often misunderstood, particularly if you've got somebody who's incredibly intelligent, they're holding down their job, they're married, but they're finding it really difficult to do daily activities, manage organisation, pay bills. So this is one main thing. Also, the tension between wanting structure, being autistic, and needing it, but unable to initiate it themselves. Or the autistic part may get completely bored with that and the repetition of the routine, and then suddenly it all goes out the window. So these are just some of the, overlapping challenges that can be presented. The tensions can be different for each autistic and ADHD individual. So it's important when you're seeing a psychologist or a counsellor that you're able to make those distinctions. So how do clinicians and psychologists go about diagnosing autism and ADHD when the symptoms are so similar? Well, ideally, you need to go through the standardised recommended tools. So this could be for ADHD, for example, seeing a psychiatrist or psychologist that's trained in the DIVA, the QB check, or the Connors assessment, speaking to other informants, getting school reports, and most importantly, listening to the people's experiences. What has been their experiences from their recollection? So for autism, you're looking at seeking somebody who's also trained in the recommended gold standard tools. So these could be, for example, the ADOS, the ADIR, the AAA, or a more lengthy assessment and in-depth would be the DISCO, which is an assessment that was developed by the Lorna Wing Centre. So if we think about the assessment for an autistic and ADHD person, you really want to incorporate all these good assessment tools. I think what's important to say here as well is that often these assessments don't always include the executive function challenges for these individuals in joint cases or sensory sensitivities, and it's important to look at these and how that impacts a person, particularly in relation to when their anxiety increases. Again, when you're seeking out for an assessment, it's important to look at the individual's regulating body and to ensure that this person's got adequate experience. So some final takeaways. If you suspect you have ADHD and are autistic, what are the next steps you can do to seek support? 1, are you thinking about an assessment? If so, consider screening tools such as the Autism Quotient or the CAT-Q. And to look at these, you can view the following websites. And for ADHD, there are some screens available. You've got the Russell-Barkley scales. And so if you look at the following websites on this link now, and you'll be able to access those.
Subscribe for more insights from the experts at Harley Therapy, and don't miss our next video.